welcome to another Explore Owens session. We are joined by our chair of our nursing department, Irene Jones. Hi Irene, thanks for being with us today.
No problem.
Go ahead and stick your arms out for me. We are here socially distanced. We're going to go ahead and remove our masks so you at home can hear us better. Thanks again, Irene, for joining us. Today we're talking about the Lpn-Adn program. Is that correct?
Correct.
Could you just briefly tell us information about the program? What does Lpn-Adn stand for? About what we're seeing in front of us? Just about the program.
The Lpn-Adn program is for licensed practical nurses that already have the license. Then they come back and they go through the nursing program to get their associate degree in nursing, which makes them eligible to take the NCLEX RN exam and become licensed as an RN. So it's a bridge program. It only takes 3 semesters versus the traditional 4. So they're able to complete in a shorter amount of time and get out there working as an RN.
Gotcha. Awesome. So you said on average students take about 3 semesters to complete this bridge program.
The bridge program is 3 semesters. Many of our students come in with transfer credit. So they've knocked out some of the general education courses already. And what we do is when they complete first semester, which is NUR 110, they are awarded advanced standing credit towards their final completion. So that's where the difference in the programs come from.
Gotcha.
Yep.
Can you tell us a little bit about some of the equipment that our students would be using? We're here in one of our lab spaces. This is where students do checkoffs. They have a professor, is that correct? In with them, and they'll perform an action, and you guys will tell them how they do.
In our nursing labs on both campuses, Toledo and Findlay, they have low, mid, and high fidelity mannequins. And so this is one of our mid fidelity mannequins. She is dressed up for what our students are currently being checked off doing, which involves IV medication administration. So these are the same pumps that our students will experience in the clinical setting and as patients will experience in the hospital setting. So they are required to come in, they have to calculate their medications based on the MAR that we give them, their medication administration record. They have to calculate it all out, do the drug calc, show it to their instructor, administer the medication, and then they would be assessed on their skills. One of the drugs that we do use are eye drops, which is why we keep cotton in the mannequins to absorb the liquid in case she looks a little funny. But we try to make our laboratory setting as realistic as possible so that when the students transition from the lab setting into the clinical setting and then eventually into the work setting, they have seen a lot of the equipment already in the lab setting and they're comfortable with it.
A lot of hands-on experience before you ever touch a real-life human patient in the work setting.
The benefit with our Lpn-Adn Bridge program is our students are already licensed as LPNs, so they have a lot of that patient care knowledge. Now we take it to the next level as an RN. So many of them are comfortable coming in and already talking to the patients, talking to their instructors, reviewing skills and learning new skills that they'll use as an RN.
That's so wonderful and awesome. Jason behind the camera said that he's been to the doctor a couple times and has encountered Owens alumni that have gone through this long-standing program. We've had nursing here at Owens for a very long time. Very well received, very popular program. Are there any other careers other than maybe a traditional nurse that our students could explore with this program? I know it's that bridge program to being an RN, going into the nursing field. Is there any other paths that our students could take? It
opens a lot of doors for our students. LPNs right now traditionally are working in doctor's offices and extended care facilities. When they're coming to us and they want to bridge into the RN program, some will go back to their same employers and take an RN role. Many will move on to a hospital setting. And then we even see many are moving on into the bachelor's and the master's degrees because they want to move up that leadership ladder, or they will go and become a nurse practitioner. There's now a doctorate of nursing practice available for students too. Many of our graduates stay right here in Northwest Ohio and Southeast Michigan. We have a campus in Findlay, on the Findlay campus I should say, a program down there, and they will hire many of our students in the Findlay and surrounding areas. So we see, like the encounter before, is that many employees in Northwest Ohio are coming from Owens, especially in the healthcare field.
That's excellent. Well, thank you both for joining us today for another Explore Owens. This is Irene Jones, our chair of our nursing department. Again, my name is Maddie Harris, part of our admissions team. I wish you well on your journey, and remember that your success can start right here at Owens with Irene.
Thank you.